Is vaginal atrophy reversible? If you've been dealing with dryness, pain during intimacy, or constant discomfort down there, you've probably asked yourself this exact question. Today, I'm going to give you a real answer and some real solutions. I'm a pelvic health advocate who spent years helping women navigate the challenges. I founded VuVatech because I saw way too many women suffer in silence like me, thinking this was just their new normal. Spoiler alert, doesn't have to be. What's actually happening? First, let's talk about what vaginal atrophy is. Your vaginal tissues need estrogen to stay healthy, thick, elastic, and naturally lubricated. When estrogen drops during menopause, breastfeeding, or after certain medical treatments, everything changes. The tissue thins out. Sometimes it becomes almost see-through. Blood flow decreases, natural lubrication stops. The pH balance suddenly shifts, and suddenly you're dealing with the sandpaper-like dryness, burning sensations, tightness, and pain that makes intimacy feel impossible. Here's what a lot of women describe: constant irritation, like you can feel every seam of your underwear stinging when you urinate, not from infection, but from fragile tissue. In sex, instead of pleasure, there's a sharp tearing pain. Some women even experience light bleeding because the tissue is so delicate, it tears easy. If any of this sounds familiar to you, you're definitely not alone. Can it be reversed? So, can it be reversed? The hopeful answer is yes, in many cases, absolutely. When we say reversed, we mean restoring your tissue to a healthier state. Thicker, more elastic, better lubricated, and here's the amazing part. Your vaginal tissue has this incredible ability to regenerate when you give it what it needs. Now, let's be realistic. How well it reverses depends on a few things. How severe is the atrophy? Mild to moderate cases usually respond very well. Severe, long-standing cases where the vaginal canal has narrowed significantly, that takes more time and effort. Consistency matters too. This isn't like taking antibiotics for 10 days and you're done. It's more like managing dry skin or high blood pressure. You need ongoing care to maintain your results. And the treatment you choose makes the difference too. Some options provide symptom relief. Others actually reverse the underlying tissue changes. Let's talk about what actually works. Local estrogen therapy is often the most effective for true tissue regeneration, and I want to emphasize local. This means you're applying it directly to the vaginal tissue, not taking pills that go through your whole body. The absorption into your bloodstream is minimal. You've got options here: estrogen cream that you use with an applicator, tiny tablets you insert, or a flexible ring that stays in place for 90 days. Most women start noticing less dryness within a few weeks. Real improvement in elasticity and pain, that usually takes a few months of consistent use. But maybe hormones aren't right for you. That's okay. Non-hormonal moisturizers used 2 to 3 times a week, like New Eve, can really help with daily discomfort. They don't reverse the tissue thinning, but they provide solid relief from dryness and irritation. Lubricants are your friend for intimacy, water-based or silicone-based, fragrance-free. Use them generously during any sexual activity. And here's when I get really passionate: vaginal dilators. These are gradual sets of smooth medical grade devices that help gently stretch your tissue. You start small, really small, and gradually work your way up as your comfort improves. Why do they work? 3 reasons. They physically help restore elasticity. They improve blood flow to the area, which promotes healing, and they retrain your brain. When sex has been painful, your nervous system learns to clench up. Dilators can give you pain-free penetration experiences, teaching your body that it's safe to relax. We created VuVatech dilators specifically with this in mind. Body-safe materials with support resources to guide you through the process. What about natural remedies? Look for phytoestrogen-rich foods like soy and flax seeds might help with mild symptoms, staying hydrated, eating healthy fats, maintaining regular sexual activity. All of this supports vaginal health. But honestly, these alone usually aren't enough to reverse moderate to severe atrophy. They're great supporting players, but not the lead. Here's the part that nobody likes to hear, but you need to know. Because atrophy is caused by low estrogen and that hormonal change is permanent, symptoms will come back if you stop treatment. Think of this as a maintenance plan, not a cure. Just like you wouldn't moisturize your face once a day and expect it to stay hydrated forever, vaginal tissue needs ongoing care. Your long-term plan might include a maintenance dose of estrogen once or twice a week, regular moisturizer use, occasional dilator sessions to maintain elasticity, and prioritizing intimacy that keeps blood flowing to the area. This isn't a burden, it's self-care. It's choosing comfort over suffering. Bottom line, you don't have to accept pain and discomfort as your new normal. Vaginal atrophy is treatable, it's manageable, and yes, it can often be reversed. Start by talking to your healthcare provider about what's right for you. Explore local estrogen. If you're a candidate, try non-hormonal moisturizers like New Weave and good lubricants, and consider dilator therapy to help elasticity and comfort. You can also see a pelvic floor physical therapist as well that can help you with dilator therapy. If you want to learn more about vaginal dilators and how they can help, check out VuVatech.com. We're here to support you through your journey. You deserve to feel comfortable in your own body. Let's make that happen.